We'll start today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. This morning, we are also joined by Darkenya Waller, Executive Director of the Legal Aid Society of Middle Tennessee and the Cumberlands, and Erica Mitchell, Chief Community Impact Officer at the United Way of Greater Nashville. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. Over the past weekend, there has been an upward trend in cases, and Dr. Jahangir will discuss this in more detail. The number of tests has increased, but the number of cases has increased at a higher rate, and the total number of active cases in Nashville has increased by 25% over this weekend to 1,008. Now, we must flatten the curve of the COVID-19 in our community and save lives, so I urge everyone to stay focused on preventing the spread of the virus. Please continue remaining at home whenever possible and wear face coverings when social distancing measures are difficult to maintain as you run your essential errands. Now, as I mentioned last week, the Tennessee Major Metro's Economic Restart Task Force is working closely with the state to plan and coordinate the restoration of local business activities that are currently suspended due to COVID-19. Having a restart roll out in a safe way is obviously a public priority. Now, here in Davidson County, we must safely transition to the next phases of our COVID-19 response and recovery efforts while listening to our public health experts, and this will ensure that we do not lose the hard-earned progress we've all worked together to achieve over the past several weeks. In the meantime, there are resources to help Nashvillians who are facing financial hardships during this time of historic challenge for our community. Now, this morning, I'd like to welcome Darkenya Waller, Executive Director of the Legal Aid Society of Middle Tennessee and the Cumberlands, who is here with us to talk about protections and legal remedies available to those who may be having a difficult time making rent and mortgage payments during this time of virus. I'd also like to welcome Erica Mitchell, Chief Community Impact Officer of the United Way of Greater Nashville, who is joining us to discuss how Nashvillians can apply for direct mortgage and rent payment assistance through the COVID-19 Response Fund, and why it's important for members of our community who are able to contribute at this time to support the fund and its many grantee organizations across Davidson County. In addition to the resources available through the COVID-19 Response Fund, I want to remind all Nashvillians that the Metro Action Commission can provide rent, mortgage, and utility assistance to qualifying families. Please visit nashville.gov/MAC for more information how to apply for these emergency funds. Now, until further notice, the Nashville Electric Service, Metro Water Service, and the Piedmont Natural Gas Company have placed a hold on late fees and utility cutoffs for late payments or non-payment of bills, and the Davidson County Sheriff's Department has suspended evictions citywide, which includes all MDHA properties. If you have not applied for unemployment assistance, please do not hesitate to visit covid19.nashville.gov and follow the Need Assistance link to find instructions on how to apply. And remember, new federal legislation has expanded both the amount of unemployment benefits being distributed and the qualification parameters for applicants throughout the state of Tennessee. So visit covid19.nashville.gov and click the Need Assistance link today. And as always, I urge everyone to visit Metro's COVID-19 website and donate, as you are able, to the COVID-19 Response Fund, which has been created to provide needed relief, including assistance with rent and mortgage payments, to Nashvillians during this time. You can also visit the website to learn how to obtain direct financial, food, mental health, and social service assistance. And now I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest update on COVID-19 in our city. We now have 1,903 confirmed cases in Davidson County, an increase of 152 over the past 24 hours. So far, we also have 20 fatalities in our city. There are an additional 1,712 cases in the surrounding counties, bringing the total for our region to 3,612. Of the Davidson County cases, 1,008 are currently active cases, and 875 residents have fully recovered from the virus and have been cleared. Now, since our last press conference on Friday, the trend has not been good, as the mayor stated. While testing has increased by 11%, the number of people who have been tested positive has increased by 19%. To put this in perspective, last week, from Monday to Friday, testing increased by 7%, and the number of people who tested positive increased by 10% during the same time frame. Furthermore, the number of people who are currently infected with the disease increased by 25% over the past 3 days. Now, this tells us that over the past week, there is a greater rate of infection than the previous week. As I stated last week, we are still in a battle with this virus. Today, the 3 community assessment centers are open from 9 a.m. to 3 p.m. On Friday, 609 people were assessed and 605 of them were tested. This is the most people we had assessed in a single day since the centers opened on March 31st. And this brings our total number of people assessed at our centers to 3,074, and 2,336 people were tested at these sites. There continues to be short wait times, and the process takes less than 10 minutes, and there's no cost for the assessment or the test. You can drive up or walk up if you don't have a car, and if you think you're not feeling well, or that you may have been exposed to the virus, I urge you to seek medical attention. Call our hotline at 862-7777, again 615-862-7777. Medical professionals are standing by to answer your questions and determine if you need a further assessment. The hotline is open 7 days a week from 7 a.m. to 7 p.m. And finally, as you can see, we must stay vigilant. We are not out of the woods yet. Please stay at home. Only go out if it's absolutely necessary. If you have to go out, practice social distancing and wear a face covering, and return home right away. That's how you're making a difference, Nashville. I appreciate your efforts, and please help us keep the word to your friends and family about how to not spread this virus. Now I would like to introduce Darkenia Waller of the Legal Aid Society. Thank you.
Good morning. On behalf of the Legal Aid Society of Middle Tennessee and the Cumberlands, I'd like to thank Mayor Cooper for your continued support of legal aid and for the opportunity to speak to you today regarding our work, including some helpful information regarding renters' rights as we prepare the delicate work of reopening Nashville and Middle Tennessee economies. As Tennessee's largest nonprofit law firm, we offer free civil legal services, including representation in court, to those families who cannot afford an attorney. According to the Legal Services Corporation, under normal circumstances, 71% of low-income households have experienced a civil legal problem in the past year. With the recent increase in unemployment, we are expecting that number to increase exponentially. To supplement the work of our 45 staff attorneys, Legal Aid partners with more than 450 private attorneys from the Nashville Bar Association and other Middle Tennessee bar associations. These volunteer attorneys help us conduct more than 17 free phone legal advice clinics a month, and they offer free extended representation in certain cases when advice is not enough. Legal Aid has developed a COVID-19 resource page on our website at las.org. It contains a series of simple legal pamphlets and brochures that we've created to help demystify many legal issues being faced by tenants and homeowners today. Legal Aid can help answer questions like, what employment benefits am I eligible for? How can I get my stimulus check if it was deposited into the wrong account? If I get an order of protection for safety, who will have to move? Am I still eligible for SNAP benefits if my hours were reduced but I wasn't laid off? What options do I have if my mortgage company wants to foreclose? And do I need a will or an advance health care directive? The Tennessee Supreme Court recently issued an order which in essence prohibits the eviction of tenants. The order brings consistency between previously issued federal law and our own state and local court rules. The order does not wipe away money you may owe your landlord. It just delays when you can be evicted for non-payment. As such, here are a few things that renters may need to know. You must still pay your rent or mortgage if possible. Your rights and duties as a tenant have not changed because of COVID-19. Your landlord cannot legally lock you out of your home, turn off your utilities, or put your belongings out on the street. If your landlord wants to evict you, they must still take you to court. Again, none of these rules have changed as a result of COVID-19. You are encouraged to try to work with your landlord now to negotiate favorable terms for repayment. Do not agree to pay more than you can afford, and do not borrow money you cannot afford to pay back. Landlords do not typically want to evict. However, they too may be experiencing challenges during this difficult time. You are highly encouraged to seek out the various financial resources that you'll hear more about later. Once the economy opens up, you may receive an eviction lawsuit for non-payment of rent. If you receive a summons to court, please go, even if you don't have an attorney. You will have a much better opportunity to ask for additional time in your home or business if you go to court. If the court does evict you, you will have an additional 10 days before a sheriff's deputy will actually show up to physically remove you from your home or remove your belongings. If your landlord uses self-help measures to evict you, like turning off utilities or changing your locks, or if you just need legal advice, please call 800-238-1443 to speak to a lawyer. We have several upcoming phone-in legal clinics where lawyers will be available to speak with you for free. You can find our list of phone clinics on our website at las.org. Our next legal clinic is tomorrow from 4 to 6 p.m. You can also ask questions by email at tn.freelegalanswers.org. Keep in mind the laws and rules are ever-changing, so please seek legal advice. Again, you can call 1-800-238-1443 or go to our COVID-19 resource page at las.org to learn more. I'd now like to welcome Erica Mitchell of the United Way.
Good morning. United Way of Greater Nashville is proud to partner with Mayor John Cooper's office, other local business and nonprofits to help support our community through this very difficult time. We recognize that there are a multitude of needs in the community. There are many who have never engaged with social services and are having to navigate resources for the very first time. There are others who have been hard hit by the tornado, and they are now struggling under the dual crisis of the weight of both COVID and tornado impacts. Some folks have received their stimulus checks, but others, those checks are weeks away from occurring. There is not a single organization nor a single sector of the community that can help meet all of the need. But collectively, we believe we can reach the masses if people know where to get help. Our goal at United Way is to help people navigate the resources that are currently available through both local and state resources. We encourage people to visit United Way's COVID-19 response website at NashvilleResponseFund.com. That's NashvilleResponseFund.com. Go there and click Get Help. There you will find resources on everything from food, financial assistance, unemployment services, utility shutoffs, financial counseling, and more. If you are a restaurant worker, bartender, musician, a healthcare professional, a beauty professional, etc., go to NashvilleResponseFund.com to get information on where you can get help. To date, the Response Fund has distributed about $2 million to more than 70 nonprofit organizations. These organizations are meeting a broad range of needs, from mental health and crisis counseling to food and financial assistance, PPE, as well as basic needs supports. I also want to encourage people to visit the Financial Empowerment Center website. The FEC is a long-standing partnership between the Mayor's Office and United Way. There, the financial counselors can help individuals learn how to navigate this new financial situation. Counselors know what impacts a person's credit the most. Counselors can help with the prioritization of bills. They can help negotiate due dates of when those bills are coming due. The Financial Empowerment Center is completely free of charge, and we encourage folks to visit the Financial Empowerment Center website for more information. The COVID-19 Response Fund is comprised solely of private donations from individuals, businesses, and foundations throughout the community. These are people who have given to help our neighbors in need during this very difficult time. We are extremely grateful for each and every one of these donors. The need is great. We have waiting lists of people who are in need. They want to put food on their tables, help pay their bills, meet their basic needs. Every donation, whether it's large or small, makes a huge difference. So we're asking the corporate community, local foundations, and individuals to join us in helping our community. Please consider giving to the Nashville Response Fund by visiting NashvilleResponseFund.com or texting Nashville United to 41444.
Thank you, Ms. Mitchell. Ms. Waller. We will now start the Q&A segment of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Jeremy Finley at News 4.
Hey, good morning, everybody. Thanks again for taking our questions in these tough days. My question has to do with the businesses that have been shut down by the city, found to be not essential but still open. I've reviewed those lists, and some of the businesses seem pretty crazy that they thought that they were essential. I wanted to get an idea, when your investigators are talking to these businesses, are you feeling that they are remaining open out of desperation, or are they truly feeling like that they're essential?
Dr. Caldwell.
We look at the Safer at Home order as it's written, and we work with each of the individual businesses where we get any complaints, whether it be on the Hub Nashville on your smartphone or at the covid19.nashville.gov site. And what we find is that most of these businesses are compliant and they are abiding by the Safer at Home order. What we try to do is assure that the businesses are practicing CDC guidelines, social distancing inside with their employees, and that they also do everything they can to either do mail-in or curbside. So it's on a case-by-case basis, and we work within the guidelines of the interpretation of the Safer at Home order as it's written. So thank you.
Julia Palazzo, WKRN. Julia?
Good morning. Thank you, Chris. Thank you, everybody, for the update. Mayor Cooper, a couple of questions for you. With the large increase of cases over the weekend and talking to the mayors that you teamed up with, are you any closer to determining when the economy will reopen, like a set date or week? Because the Safer at Home order, I know you said you anticipated extending it to the end of the month, but has it officially been extended to that? And also, are you in a position where city and county employees may have to be furloughed? Thank you.
Thank you, Julia. Mayor Cooper?
Well, Julia, a lot of work is going on this week on how to have a safe restart. And I hope by the end of the week there'll be a lot of progress. I know there's a meeting going on this afternoon between the cities and their respective economies. Now, I expect an announcement probably tomorrow on the formal extension of the Safer at Home order. I think having it, I think people should expect, particularly with today's news, that will be extended for a period of time until we are certain that the rate of the disease is declining in Nashville. And then on city and county furloughed employees, we are doing everything possible so that that does not happen. Protecting our employees, we have so many employees who are providing the front line of response to the virus. All our public safety and public health employees. And frankly, we are in a money pinch. We're going to have to make a lot of maybe short-term measures to get through that money pinch, but we're going to be a great city on the other side of this. And we're going to have a restart. We're going to do a restart safely, and we're going to have a fully served city to make that restart possible, but it's not going to be easy. Thanks.
Tosin Fakile, News 4. Tosin.
Hi, good morning. Thank you for taking my questions. Two questions. The first to Mayor Cooper. We know that there's a rally later on this morning calling for the governor to open the economy. I was just wondering what your thoughts on that and what your message is to those people asking that the economy opens up, which includes Nashville. And my second question to Dr. Jahangir, this increase in cases, where do you think it's coming from, and do you think that's going to affect your decisions to reopen the economy as soon as possible here in Nashville?
Mayor Cooper.
Well, for the rally, I'm all for the rally. I just want everybody to do it safely. And remember to socially distance yourself while you're doing the rally. This is a period of time that we can't, we want public participation, but we want it safely. We hear their message and agree with the message. We want a restart. It's just going to be a priority to have the restart done safely, not to undo the progress. And what we really want is the long-term mitigation of the disease, to keep our healthcare capacity in place and available for those who may unfortunately need it. Thank you.
Tosin, regarding the case number, there's not a set cluster. That was one of my first questions I asked last night when I saw this report. It's just an increase in cases that all over the city. So there's not one specific incident in which I can point to and say that's why we went up 150 something cases. So just it is what it is. Thank you.
Kara Hartnett. Go ahead, Kara.
Hi, thanks for taking questions. I guess I'm just wondering what is stopping Metro from expanding testing right now, and what are your plans to do so in the future?
Dr. Jahangir.
Garrett, I want to highlight that on Friday, 609 people went to our assessment centers. 604 of them received a test. We are essentially testing anyone that feels ill or is worried that they may be infected, whether it's by close contact or another reason. I also want to highlight 604 is almost twice higher than any other day that we've run our assessment centers. But as I mentioned of last week, we do still conduct an assessment because you may have shortness of breath because you're having an asthma attack, or you may be having a heart attack. And I think people need to be very clear that you're going to get a medical professional seeing you when you go to one of our sites. They're going to see you. They're not going to charge you anything, and they're going to take care of you. And yes, a majority of people show up to the sites because they feel ill or have a reason they're worried about COVID, and they'll get a test. But again, the symptoms of COVID: shortness of breath, cough, fever, new onset loss of smell, and new onset unexplained diarrhea. So if you have those symptoms, you think about COVID and get assessed. So thank you so much.
Harriet Wallace, Fox 17. You're on the air, Harriet.
Hi there. Good morning. I do have two questions this morning. First, I want to talk about the Bordeaux nursing home outbreak. Can I get you all's response to this outbreak that we've seen in the nursing home? And then what is the proactive not reactive plan that you all are working on to address this? We've seen colleges close their campuses because of this concern. How will the health department enforce and monitor rules there? Because either someone did not follow guidelines and needs to be held accountable, or we've got a bigger problem on our hands. We've got the virus, they're testing for it, and it can't be detected. My second question is, I've heard from some essential workers who are saying that they need to be tested and go right back to work. However, the lines are so long because everyone's being tested. Is there a chance that a special site or center could be set up for the essential workers who have to come back and interface with the community? Thank you all so much for answering and for what you're doing.
Thank you, Harriet. So the first part of the question was about the Bordeaux facility. The second question was about testing for essential workers and the report of lines at the community assessment centers.
The facility at Bordeaux is one where I would like to let you know that it's very much focused on our public health response that has been very impactful. We immediately learned of 2 positive cases, and our epidemiological contact tracing staff went into action. We made sure that all of the employees and patients on that particular floor where those patients were tested. Once we got more tests back, we assured that there would be testing throughout the entire facility, and now we have tested all residents and all staff. We're working with the Tennessee Department of Health, which licenses this facility, as well as a geriatric specialty team at Vanderbilt. And right now, I can tell you that the facility is on full lockdown, that we have assured that everyone is in isolation and wearing full PPE. We believe that what had happened at the Bordeaux facility may have been a worker who came in from a recent trip from out of the area that introduced COVID into this facility. So what we're doing overall with nursing homes is being very proactive. We have a representative in the Emergency Operations Center for all nursing homes, and we're working with every single one of them in partnership with the Tennessee Department of Health that anytime there's a COVID positive case, whether staff or patients, that we try to test the entire facility. And that's what we're going to be doing going forward. I'm optimistic that we have identified the problem at Bordeaux and that we're not going to see additional cases, but we're monitoring it as aggressively as we can. I'll ask Dr. Jahangir to answer the other question.
Harry, regarding your essential workers and the time for tests, I'll tell you, if those individuals came to community assessment centers that we run, we're not aware of any long lines or delay times there. Secondly, essential workers of Metro, so sheriff's department, firefighters, police, and so forth, there is a process that we have that they go through that's independent of our community assessment system. And I think every place of employment that has essential employees should have a plan for those individuals. So I can't speak directly to the incidents you're referring to, but I can tell you the city sites that we run have not had a long wait. Thank you so much.
Ian Jong at the Tennessean.
Hi, good morning. Dr. Jahangir had highlighted that the assessment sites had tested, almost twice as higher than any other day in Metro. I was curious if he could see if that signals that maybe the want for testing or the demand for testing has increased in Davidson County, and whether that could mean Metro would set up additional sites or possible drive-through sites. If not, curious on kind of what would be the factors preventing that from happening.
Thank you, Ian. Dr. Jahangir.
Sure. So to answer your question about do we need to add another assessment site, I think we very closely monitor the demand of our assessment sites as a factor of lines and so forth. We have a reasonable process that I don't think right now mandates another need for an assessment site. I have to remind you, in addition to our assessment sites, there are lots of great healthcare systems here in Nashville that are conducting tests, and we've had almost 18,000 tests conducted in our city, and about 3,000 of those were our assessment sites. So remember that. Regarding your question, so as I mentioned, from Monday to Friday last week, that we had an increase in 7% in cases. In tests, and an increase in 10% in cases. Friday to today, we had 11% increase in tests and 19% increase in cases. So there actually were more tests conducted in a shorter time frame in Nashville, but a greater percentage of those were positive. So I think what this tells me is that this virus is still active in our community. As I mentioned in an earlier question, there's not an active cluster per se that resulted in this large number of cases. And so people need to be vigilant. If you have worry, call our hotline. If you've been exposed, you have any of the symptoms I talked to you about, get assessed. Whether it's at our assessment centers or at your healthcare provider, get assessed and get tested. Thank you.
Nayeli Alamia from 96.7.
Hi, thank you. Good morning. I have a question for Ms. Waller from Legal Aid Society. What are the requirements to receive those services, and do they have to have legal status? And I also have a question for Dr. Jahanger.
What is your question for Dr. Jahanger? Go ahead, Nayeli.
For Dr. Jahanger, how do you think now that we have free testing statewide, how do you think this will affect the timing on receiving results?
Okay, thank you.
To answer your question, generally speaking, our services are relegated to those persons who are low income and or struggling to make ends meet. And of course, in this current time, that has expanded that demographic because many have lost employment or are having reduced hours. We process our eligibility is 125% of the federal poverty guidelines generally. However, that may change if you are a senior, which we have an exception for, or if you are a victim of domestic violence. Additionally, as it relates to legal status, again, if you are a victim of domestic violence, we are able to assist you. If you do not fall into our current eligibility guidelines, we also partner with other organizations who do similar work on smaller scales, but are able to assist those persons that fall outside of our eligibility guidelines.
Thank you for your great question about turnaround time for lab results. The state this weekend conducted 11,230 tests in 33 sites. And I spoke with Commissioner Piercy yesterday and spoke with some of our other staff over the weekend. And this morning, I know they're evaluating turnaround time in different labs. The good news for our region and for our state is that there are now more private labs that have come online who are able to run these tests. So the goal is to get labs turned around in 24 or 36 hours. I know the state is looking at this, and we're very closely looking at this. And so my hope is that, as I've mentioned before, it's a supply and demand thing. There are now more, while there's more demand, there's now a lot more supply of facilities that run the tests. So it's something we're going to watch, and I know the state this morning has a meeting to talk about it, and I suspect I'll be briefed on that by somebody from the state health department later today. Thank you.
Those are all the questions we have this morning. A recording of this press briefing will be made available later this afternoon. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.